Welcome to the Neonatal insertion and instructional video on placement of extended dwell peripheral intravenous catheters. As you assess your patient to determine the most appropriate vascular access device, keep in mind that the chemical properties of ordered and potential infusates, length of therapy, vein size and integrity, and overall condition of the patient. If placing an extended dwell peripheral intravenous catheter in the forearm or upper arm, the catheter tip should reside below the axillary fold and above the antecubital crease. If the lower extremity is used, the tip should reside between the knee and groin or inguinal fold. Once you have decided an extended dwell PIV is the most appropriate vascular access device, you should measure from the proposed insertion site to the desired tip location prior to placement. Measurement should be repeated post-insertion to ensure optimal catheter tip position. Next, you will want to gather supplies and perform a timeout. Once the timeout is done, set up your sterile field. Maximal sterile barrier precautions should be used throughout the procedure. There are many insertion device options, and we will be using an over-the-needle peelable sheath introducer for this demonstration. The extended dwell catheter should be primed so there is no air in the catheter. Prepare the area for insertion. Two common examples are povidone iodine solution or a chlorhexidine alcohol preparation of 0.05% to 4%. Follow institutional policies and procedures as well as manufacturer's instructions for use for the application of any PrEP solution. For this demonstration, we will be using a chlorhexidine alcohol solution. Allow any antiseptic to air dry prior to inserting the catheter. Insert the needle into the vein. You will commonly see a flash of blood in the hub of the introducer with entry into the vein, although this may not always occur. Thread the peelable sheath into the vein and remove the needle. It's not necessary to thread the entire length of the sheath into the vein. Next, thread the extended dwell catheter to the predetermined tip location within the vein. Padded forceps are recommended for threading. The catheter should thread easily. If resistance is met, retract the sheath and catheter as a unit and reattempt insertion with a new device. Once the catheter is in position, grasp the wings of the sheath and peel away the introducer cannula, using care not to damage the skin. The catheter position can still be adjusted if needed. This is a good time to ensure that there is a brisk blood return from the catheter, and to measure the external length of the catheter using a sterile measuring tape to ensure the catheter is in the ideal position. The catheter has black markings every centimeter that may be used to determine external length. Remove the stylet wire slowly in one steady pull. If resistance is met, stop. Do not continue to pull, as this may result in catheter or vein damage. Allow the catheter to remain in situ and reattempt stylet removal by gently pulling on the stylet after a minute. If you still feel resistance, remove the catheter and stylet as a single unit and reattempt insertion. Once the stylet is removed, attach a pre-filled syringe of flush solution to the catheter hub and flush according to institutional policies and procedures. Attach a needleless connector to the extended dwell PIV. You should be able to easily aspirate blood using gentle pressure and flush easily. Follow institutional policies and procedures for catheter dressing and securement. Never place tapes or sterile strips on the body of the catheter, as this may result in catheter damage. Do not apply a force greater than 50 psi when flushing or administering fluid. The site should be maintained using sterile technique, and the catheter should be secure. External length of the catheter should be noted frequently to prevent tip malposition. Once the insertion is complete, make sure there is appropriate documentation. Some suggestions are listed. Thank you for watching this instructional video on placing the Neomagic Extended Dwell PIV. If you have further questions or would like additional education on this product, please reach out to us at neomedicalinc.com.